Everyone, my name's Olivia, and on behalf of myself, Alma, Emma, and Dongjin, we are going to be presenting to you our evidence-based practice project. So a little bit of background on our project. We are addressing COVID-19 in the hospitals. Our site is a major teaching hospital, a level 1 trauma center, and many of the units in this hospital are being converted from normal floor units to complete COVID units. So the unit we're specifically focusing on is an ICU that is all COVID patients, all people in critical condition with COVID. So we've noticed a lot of the staff on this unit are burnt out, they're stressed. A lot of people are seeking other jobs or trying to move to other units because they just don't feel that they're being supported. Because of this, we decided to formulate our PICO question around this burnout and stress. So our specific PICO question is, what interventions can help prevent stress and mental health issues among staff who are taking care of COVID patients? The P being nurses taking care of COVID patients. The I is providing interventions, which the specific interventions we'll go over later. The C is no interventions at all. And then the outcome would be to help prevent stress and mental health issues among those nurses who are taking care of those patients.
Hi class, my name is Alma and I will be briefly summarizing our research and evidence. Our PICO question asked, what interventions can help prevent stress and mental health issues among staff who are taking care of coronavirus patients? We searched the SINHAL, Medline, and PubMed databases and sifted through 339 articles before deciding on a final 10 to utilize. Articles appraised varied in design and method. The levels of evidence range from narrative reviews to RCTs and more. Samples and settings consisted of healthcare workers working directly with COVID-19 patients in hospitals and long-term care settings. The findings show that there's a lack of preparedness in addressing interventions to prevent stress, burnout, and other mental health issues in healthcare workers during a pandemic. There was an increase in risk of depression, anxiety, insomnia, and distress amongst those workers. The recommended change of practice focuses on 3 areas: prevention of stress and mental health issues in healthcare workers taking care of coronavirus patients, management, education and opportunities if those problems have already developed, and the need for more research into this issue. If our search has produced anything, it has exposed the poor amount of research done into what could be argued as one of the most important issues facing healthcare workers this year. Thank you.
For the SMART goals to improve the mental health of the healthcare staff working directly with the COVID-19 patient, we have created a 7-week program that will offer individualized support and coping mechanism based on the result of the screening. For this program, we will need dedicated people such as therapists, educators, and psychologists, also unit managers to help create the program. If you see the Gantt chart, we will start to recruit developers and estimate about a week for recruitment. Program screening tool and education tool development will take about 3 weeks, and we will run the test before implementing the program. Screening and education will continue for about 3 weeks, and then we will evaluate the program. We are expecting the timeline from the preparation to evaluation for about 7 weeks. The program will be implemented on an inpatient COVID-19 unit, and if the program is successful, it could be modified and used on other types of units. The program will be considered a success if the evaluation tool shows a positive change in staff mental well-being after running the program and continue positive growth thereafter. To ensure the sustainability of the proposed change at the site, we intend to create a hospital-wide policy that will make mental health service available and easily accessible to all healthcare workers on the front line of the pandemic. All healthcare workers who are working on COVID-19 units will be able to access and same individualized education support coping mechanism.
Quick reflection of the process, we definitely learned how to work better together as a group, when to jump in and take responsibility, but also when to take a step back and maybe let other group members lead. And then our biggest takeaway of the project was definitely how to prevent burnout in nurses working in the pandemic. And we can apply that to our nursing careers to help prevent burnout, not just for others, but also for ourselves and the work that we do.